questions and draft regulation decision. And I am not the only one. At an event on April 28th, FDA Commissioner Kaloff was asked about ethylene oxide rulemaking, and he responded, and I quote, "This issue is very much on the forefront for all of us. We are highly aware of it, and we are engaged in discussions." He concluded with, "I'm very worried." Those worries today are even more so. In college, I spent a summer in central supply in a sterilization unit of a community hospital. I can say with firsthand knowledge how critical adequate sterilizing procedures are in regarding procedures, surgeries, and ultimately regarding patient safety. This may sound hyperbolic, but restricting ethylene oxide can paralyze Americans' medical services because of the lack of an effective alternative to ensure appropriate, safe patient care. I'm a physician. Previously, I was responsible on a daily basis for 25 or 30 patients and their safety. Today, my responsibility is for the safety of 750,000 constituents. 750,000 constituents who rely on safely sterilized equipment for their medical procedures. Beside me is a poster, and you can see the differences to the naked eye in this poster that is beside me. There are glass syringes, some treated with gamma radiation, and the ones on top are treated with ethylene oxide. You see the clear difference, the clarity that remains with the ethylene oxide treated syringes, and how the gamma irradiation discolors those syringes. In contrast, it's stark. My first question is for you, Mr. Whitaker. Why is it essential that ethylene oxide is used for medical instruments and devices for tiny parts and the crevices that needs to be sterilized?
Yeah, it's a great question. Thank you for that question. There are about 40 to 50 million surgeries a year in the United States. So we're talking about millions and millions of instruments. And the reality is, if you don't do those safely with sterilized products, patients are going to be harmed by that. And the reality is today, and this is why Commissioner Kaloff was so concerned, there's not another sterilization product that gets to all the areas of the most intricate medical supplies as it is needed. And the result is that it's going to be the likelihood of poor execution on a surgery or infections that may come from that. So what you've outlined there is one great example, but there are plenty of others and other platforms as well that would be negatively affected by using the wrong sterilization method.
I think the clarity resonates by seeing the inability to maintain clear syringes, which will be used in a multiple of surgeries and procedures. Mr. Whitaker, AdvaMed has publicly stated that the EPA's proposals, as drafted, will result in an estimated total capacity reduction at sterilization facilities of approximately 30 to 50%, or even upwards of 70% in some facilities. Right. Paint me a picture, please, of what healthcare in America looks like if 50% of our nation's 20 billion manufactured medical devices cannot be adequately sterilized. How would that ultimately affect patient care?
A terrible effect on patients. It would bring surgeries and procedures, in some cases, to a screeching halt. You would have supply shortages in hospitals that we've never seen before, and it's real. This is not hyperbole. We're not just making this up. It's real. At the end of the day, the risk associated with executing this rule in its current form is a major risk to access and patient health, and at its core, that's why we're most concerned. Now, we've suggested to FDA or to EPA a number of ways to make this palatable. We haven't yet to get an answer from them on that, but we remain hopeful that we can improve it.
Do you think we are on the cusp of a potential healthcare crisis, another one having just come through COVID?
Well, there's no question it would cause a crisis if the regulation goes into effect as it's currently drafted.
Mr. Whitaker, the proposed rules issued by the EPA earlier this year to implement additional regulations for sterilization facilities may result in facilities ceasing their operation and put a supply chain crisis here in the United States. It's an alarming EPA proposal that aims to change the processes for medical device sterilization. Do you believe the EPA has fully consulted with the FDA on the appropriate methods necessary to ensure medical devices are sterilized?
I would hope they have. I'm not sure that they have. Had they, I would suggest Commissioner Califf would not still be concerned. So if he's still concerned, I would suggest more consultation is required because we have to get this right.
Thank you for your clear answers. Your concern are our concerns on this committee as well. Mr. Chairman, I yield.